So, Dr. Zink, Dr. Elnahal is talking about the lull that we are entering as cases drop off and the mental health break that many of us
Mhm.
are so eager for. At the same time, what happens if there is an upsurge again? Do you feel like we are in a position where the folks in Alaska will be receptive to that message? How would you be able to get them ready if we have to go back to more restrictions?
Yeah, no, thanks for that question. I think we are all exhausted from COVID, from public health professionals to the frontline healthcare workers to the public. And I think what we've really seen throughout this pandemic is that public health and health isn't just a subset of things that happen in the hospital. A healthy economy is built on healthy people. School health is built on healthy kids and healthy teachers being in place. Tribal health is public health. All of these things are connected and working together. But ultimately, mitigation efforts only work as well as people choosing to use them. So, be that masking, ventilation, distancing, making the choice to get vaccinated. And so, I do think it is upon governments, it's upon leaders, it's upon scientists to make sure that we're explaining the information and empowering individual citizens with the resources and the tools to be able to have to keep themselves and their communities safe and healthy, but also pulling those things off when it is time to pull off. You know, Alaska is bigger than Montana, Texas, and Montana, Texas, and California combined. And so we've had certain communities that have really kept COVID out by doing a lot of testing prior to people coming in. We have some regions that are greater than 95% of those who are eligible who are vaccinated. And we have other regions which are less than 30% are vaccinated. So, what this looks like in different places around just our state, around the country, look very different depending on those choices of mitigation efforts that those communities have embarked on. And we have a lot more tools now. So we really need to use 2022 tools for 2022 challenges with COVID. We were a really different place 2 years ago. And it's fantastic that we've come so far with having such incredible, efficacious, and safe vaccines and so many more tools and better understanding this virus than we ever had before.